CDHB.
I haven't brought the dog with me, no. I could have done. We could have sung you a song. Good afternoon, everybody. I'm here as a public health physician representing the District Health Board. So although I am one of the medical officers of health for Canterbury, this is a CDHB submission, and I'm accompanied by Sandy Brinston, who is from our Health and All Policies team. Thank you for the opportunity to be able to talk to our submission. I don't intend to read it all out, nor indeed to present you with any long speech, but I'm just going to pick out a few key issues and then give you hopefully plenty of time to ask both me and Sandy any questions you might have about the District Health Board submission. We are aware that there were some questions around social impact assessments on repairs to street plans and so on and so forth earlier in the day. And the District Health Board has recommended that improvements in footpaths and traffic signals and other things that have an impact should be prioritised in such a way that we somehow identify those areas perhaps causing the most accidents, perhaps leading to the worst health outcomes, and that they be fixed first, prioritised rather than just say a grid system of repairs. We support your prioritisation of the cycleways, 4 main cycleways, and support anything that makes this a more cycle-friendly city. It is good for the health of our community. It reduces costs for the District Health Board. On smoke-free issues, we endorse the smoke-free, that the Council endorse smoke-free 2025. We recommend that the promotion of Council's smoke-free policy is added to promotional material produced for residents and visitors. And also around healthy food, we recommend that the Council work with the District Health Board on healthy foods for the Council and a sugar-sweetened beverages policy. We have recommended that a warrant of fitness system be established not just for social housing, but also for private rentals as well, so that those people who rent a house can be assured that that house is a healthy house. In other words, it's a warm and dry house. We agree with you that social capital is a key aspect in resilience, particularly with regard to natural hazards, but many other aspects of our life as well. And we recommend that funding for social and cultural groups is recognised as playing a role in building this social capital and in improving the resilience of our communities. Finally, the only other thing I'll mention, there are many other things in our submission. Please, could the Council notify the local alcohol policy as soon as possible? Our District Health Board spends $100 million a year fixing up the consequences.
I can't, this is the LTP, and I've ruled that I'm not taking any comments on it, but right. Noted.
Noted, good.
Thank you. Right,
any questions?
Oh, sorry? There's lots of questions.
So is it, are there any questions?
No, yes. Ellie, Pauline, Vicky, Phil.
Thanks. Alistair, I just had a question. You mentioned on page, oh, you won't have the same thing there, will you? Draft Volume 2, Sport and Recreation. You talk about the CDHB disappointed that the council is not going to replace paddling pools, and you list them there, including Aberley Park, which is one that's used hugely in our ward as well. We totally support that as well, and you've recommended the council maintain all 7 paddling pools in Christchurch. Would the CDHB be prepared to help fund that? And I'm not being smart, I mean, we're looking at partners, and we agree that this is a hugely important from a social wellbeing as well as a general health perspective. Is there a possibility to partner in a funding way here?
I'm not the person to ask. I don't hold any purse strings for our district health board.
Okay, no, fair enough, fair enough.
I can't answer that.
Pauline?
We hope you'll pass the question on to the appropriate person then. The hospital has a coal-fired boiler.
Mm-hmm.
Do you know, are there any plans to upgrade that to a cleaner system?
There is, and the board, the board of the district health board is looking at their options around that. The proposal is that there will be a boiler that can be a more have a more sustainable fuel source. So a wood-fired boiler that would be using renewables rather than coal.
Yeah.
The proposal at the moment is that the boiler will be able to do both, and I understand that that not only will it be able to do one or other, but it can be switched from one to the other. If I think the initial plan was to continue using coal and then switch to wood chips. I believe that can be done.
All right, well, thank you.
But we have asked. I mean, as a public health unit, we are particularly concerned about the district health board's role as a leader, if you like, in sustainability.
Yes, thank you.
Vicky?
2 questions, thank you. One, in relation to any new social housing is built using LifeMark and Homestar standard. Have you made that similar submission to the district plan review?
Yes, we have.
Excellent. And
Excellent.
The second one that you mentioned was about a sweet and sugar policy.
Yes.
Do you want to elaborate a wee bit on that?
Essentially, I think we need all large organisations, and the district health board is the largest employer in the South Island, but the council itself is a substantial employer. Need to consider the kind of example they set internally around the kinds of foods they provide. For us, it's for our patients as well as for our staff, and there are many organisations that, without consideration, provide, for example, highly sugared drinks, which are not good for us. They are leading to, contributing to the obesity crisis that everybody is well aware of. And there are options around that, but it needs to be set in policy by those organisations that permit people to sell such products on their property. And the District Health Board looks at its food policy, and we would like to work with you on yours.
So you actually have a food policy?
We do have some areas where that's considered, but we don't. I think we don't have a finalised policy as such. Put it that way.
Okay.
Thank you. Phil?
Alyssa, can I just ask you, thank you for your comments, particularly about social housing and DHB's support of that. What I just wondered is, in terms of your policy, say, around continuing to, I'm just wondering, is there a way of extending that support above what you currently have in relation to mental health services and working with our social housing clients, and how that might work out in the future? And I heard you say, look, you don't have the purse strings, but I guess I'm referring to extending the current allocation of staff so that, in fact, especially in these really challenging times, that partnership might be more fruitful.
We do have a member of staff in the public health unit who works with environmental health officers, looking at houses, providing advice to tenants around retrofitting houses and around ensuring that house, whichever one they're looking at, is as healthy as it possibly can be. We would welcome any collaborative work on looking at improving the effectiveness of that staff member or others if you feel that more were needed.
I'm wondering, particularly in the area of mental health advice that the DHB specialised staff have, and I think they already contribute. There's no question that Sandy's nodding. But how, in fact, we might, and I'll just perhaps leave this with you, how, in fact, we might extend that working relationship.
I think that would be a good thing to do, and we could look at more specific assistance or collaborative work rather than the population-based stuff that we do as well.
Excellent. Look, thank you very much, and can I, on behalf of everyone, thank you for what you do for our city. We have a very constructive working relationship with the DHB, and we value what you have to offer, and so thank you very much.
Thank you.
Right, to adjourn the meeting until 7 o'clock.